Hi everyone, I'm Dr. Rakheee, consultant pediatrician. Welcome to my Sunday's live session. Today I have with me Professor Dr. Sanjay Rampal, who is an epidemiologist and a public health specialist, and he'll be joining me as we discuss on how to mitigate the ideal measures to mitigate a pandemic. Let me just add him into just give me a minute. Let me just add him in. Hi everyone. Just give me a minute. Hi Sanjay. Sorry, hi Prof.
Rakhee.
Thank you so much for joining me on this Sunday, taking your time out and on your busy schedule to do this live session with me in view of the sudden EMCO in Klang Valley. So thank you so much once again. I've introduced you as Professor Dr. Sanjay Rampal, epidemiologist and public health specialist, but would you like to tell us a little bit about yourself as well?
Thank you, Dr. Rakheee. So my name is Sanjay. I have been a medical doctor since '98. I graduated from Bangalore, served in Klang, Saldang, and after that I've been with since 2005, I think, for the past 16 years. In addition to that, I completed my master's from Harvard, completed my PhD from Johns Hopkins, and an average Joe otherwise.
Wouldn't call you an average Joe, definitely an intellectual Joe. In light of the recent sudden EMCO, I've already lost the term of MCO, EMCO, and all the rest of the COs. I'm really beginning to forget. I mean, this is pandemic fatigue or just brain fog. I'm not sure what's going on, but would you like to just tell us what is a pandemic?
So basically, a pandemic happens when there are outbreaks. There is an epidemic all over the world. So the differentiating factor is that these epidemics are actually new diseases that crops up usually, and they can also be pre-existing, but in this case for COVID-19, it was a new disease. The novelty of the disease actually spurred a lot of the actions initially I would say the first 6 months of last year. We were very, very scared of this disease. However, with time, now it's already 17 months, I think 17 to 20 months, depending on where you live. In Malaysia, we have had this for 17 months. We know a lot more about the disease. One of the problems, though, is,
Yeah. Sorry.
Continue, Rakhee. No, it's okay.
No, I was just going to say,
so basically, we have learned a lot more.
It's been with us for 20 months, almost 2 years now. We've been in a pandemic. So when do we consider an end to a pandemic? Because how do we decide, okay, we're over, the pandemic is over, guys, back to normal? When do we decide that?
I think the issue is not so much the term pandemic, but the overreaction to the disease, right?
Okay.
So if you ask when, and this question comes up, when will the pandemic go? The pandemic may not be over, because the pandemic just means that it's a global, a widespread situation where we have a lot of outbreaks happening in a lot of countries. If you ask me, I think this will go on for years. Initially, we had this hope that it will be done by this year, and now there are certain parties trying to sell it that will be done by the end of the year or the end of next year. But if you look at the evidence, it's here to stay.
Oh, that's not very encouraging news, but thank you for the honesty.
No, but the point is this, you see, the point is when it first came up, right, that as I said before, novelty of the disease. So the novelty was we did not know whether this was a life-ending, population-ending epidemic. When it first happened, we thought that, damn, 80% of the population may die, right?
Yeah.
That was a lot of fears there. Then we say, no, not 80%, maybe 5% of the population will die. Now, 5% of 7 billion or 8 billion is still a lot of people. But over time, what we have done is we have noticed that it's not 5%, it may be more closer to 0.5 or maybe even 0.1% of the population. Now, taking into account that every year 2% of our population dies, and 4% of the population actually gets regenerated through new deliveries and new births. So 2% of the population dies nevertheless every year. So 0.1% of the population dying is true. It's sad. It's a bad reality, but it's nothing compared with the 2% that's dying every year.
Okay, all right. So what are the public health measures that can reduce or improve the rising, soaring number of cases? What are the public health measures that I know there are so many things that have been happening in the past 1.5 years, but nothing seems to work. We started at 7,000 cases in May. We're still at 7,000 cases. And in fact, Selangor had 3,000 cases yesterday. I mean, we're in lockdown for 5 weeks.
You
What are the ideal measures?
You bring up a lot
Frustrated.
of interesting issues, right?
Yeah.
Number one, with regards to numbers, let me address this with numbers, then I'll go to public health. The
Right.
numbers have been wrong for a long time now, right?
Okay.
I have data to substantiate it, but because of the platform, I will just simplify it. We have been, in my opinion, we have been underestimating cases for the past few months due to whatever reasons, right? And it happens. It's not intentional, but I guess it is what it is. The point is, because of the test positivity has increased tremendously, it's not high at a global sense. So when we compare with other countries, we're doing really, really well. But the issue is this: if you're doing excellent for a long time period, when the infection was low, and then we come to this period where we're not doing so well, it seems that we have a jump. I would say the jump is twofold minimum, where we've been underestimating the cases. So if you ask me, I think at the start of July, we were having more towards 25,000 cases, true cases. So there's a difference between true cases and also the cases that we detect. So these differences have been large. These differences have been magnified in the past 2 to 3 months for whatever reason. So the point is, we have been having about 20,000 plus cases, I would say about 2 to 3 weeks back based on mortality data. And to bring that down is difficult. Now this goes to public health measures. So if you ask me what are the public health measures, the true public health measures have been in place for a long time now. Remember that we have had a very good public health system. The issue is not the healthcare system, but the issue has been the reserve capacity of the system. What I feel is that we have had a very good healthcare system, but we were running at maybe 95% capacity in the government sector to 100%. And in addition to this 95% to 100% of utilization, you bring on COVID, which adds on maybe 20% or 30%, and then suddenly the healthcare seems to be strained, seems to be overwhelmed. So the point is, we're not overwhelmed because our healthcare system is bad. It's just because we never had reserve capacity. So this brings, again, as what I said, is number one, we were and this happens, right? We're not detecting the true number of the cases. My analysis for the first few weeks of last month of June showed that we were actually going down. The analysis, the trajectories were going down.
Yeah.
However, in the last 1 week, the data has been depressing, to say the least, frustrating, in other words, and I can feel this frustration. So what happened is, I think it was last Wednesday or Tuesday, a colleague of mine, Jason, he helped me with analyzing some data, and then we found that 65 to 80% of our cases were unlinked, meaning that 65 to 80% of our cases that were happening could not be linked to a cluster. What this meant was sporadic. All the cluster analysis are useless. It tells us nothing. And it's funny because it tells us nothing. Because I see this messaging going on in the media about how workplace is a big factor for transmission. It's actually not. Yeah, because we don't know. And the problem with this, and that's the frustration that comes in a lot of with a lot of public health people, that if you don't know where the source is, how do you expect to control the disease? And so the issue is also with MCO, right? The issue is with movement restriction. So movement restriction is actually very good when there is no sporadic transmission. I will give you an example, MCO1, for example. So in MCO1, we have MCO1, MCO2, MCO3. But in MCO1, I think, frankly, I think we overreacted. We reacted too fast. However, the overreaction was good because we controlled the disease very fast. right?
Yes.
It cost a lot, but the point was in MCO1, when we did not have sporadic transmission, we managed to get a hold to reduce the transmission very fast.
Yes.
Compare that with MCO3, FMCO, MCO, I mean it, MCO a bit relaxed, and you see the differences. The problem now is movement restriction fails to work because it doesn't make sense. So if we have a movement restriction, right, we have to go total lockdown for at least 4 weeks in my thinking, 4 to 8 weeks total lockdown. If we're not going to do that, right, all this kind of mixed MCOs, movement restrictions, all will fail. The issue is,
So you're talking about phase 1, phase 2, phase 3, right? Multiple phases, this case number, inter-district travel. So there's no point having
Let's
all
not
these
even go to
phases.
National Recovery Plan. I think you're talking about phase 1, phase 2, phase 3. Based on phases devised by whoever.
Okay, wait, that's a whole different
topic. We will never get back to normalcy, put it this way. We will always be under...
drag you back again. I'm going to pull you back again to talking about, just now you mentioned about daily numbers. So you said that we're not really, the actual numbers are much higher, right? So like every day, it comes out, oh, here you got 5,000 cases, 7,000 cases. So does that actually give us some value, like 5,000 cases, 6,000 cases, or should we be looking at other aspects? Like you mentioned case infectivity rate or case mortality rate, or, what would be better?
Actually, no single statistic will do. We have to look at the breadth of information. So the daily reported cases are just one indicator.
Yeah.
So what I would do is take the daily reported cases, change them into a rate, incidence rate or density measure. To put it in a way, the number of cases per 100,000 population or per million population. Think of it, all right? You have number of cases per 100,000 or per million population. That's the first thing. Second thing is take the case fatality into account. The fourth thing would also be to take the test positivity ratio. So the number of tests that we do, right? Let's say 100 tests we perform today. How many of those tests are positive? So a very troubling aspect is that that number was very low in Malaysia. It was like, I think, 1 in 1,000 last August. Now, for a long period, it was 4 for 1,000. That means 4 of 1,000 cases that were tested, 4 of 1,000 people who were tested became positive. But recently, in the past, if I'm not mistaken, past 1 to 2 months, it's gone up to 8% now. That means not 8%, sorry, 8 in 1,000. So 8 per 1,000 means that this test positivity is a very good indicator of how many cases we're missing out. So it just means we're missing out on a double amount. Now, there are also other indicators to worry about, and we should think about is contact tracing. That means, like, let's just say you go and get a test. How long before you should be notified of your result? So ideally, it would be 24 hours, right? In a day, you should be notified of your result. It happens in many centers, but it's not happening in centers which are very stressed at the moment. And in addition to that, there's also contact tracing. That means if you test positive, someone should call you up, find out your movements and your close contacts within, I guess, 48 hours of your test. So you have a test, you're notified within 24 hours, and then your contact traced within 48 hours. It's just frustrating that we don't have the capacity. Put it this way, a lot have been said about our ICUs, right? A lot of people have pumped in a lot of money into ventilators. But I think a problem is not many people actually give detailed thought into the public health services. The public health services have been neglected for a long time and continue to be neglected. We need increased capacity of these public health services if we are to weather or we have to live with this virus.
So you're talking about FTTIS, right? Find, test, trace, isolate, and support, basically. So basically, we are finding them, but not as many, like you said. We're testing them, but we're not giving them the results in the stipulated 24 hours period. I know some of my friends who got called, I think 3-4 days later. So then you've got to trace.
If you get called within 4 days.
Yeah, so yeah, 3 days is actually pretty good. Previously it was 5-6 days, so now it's 3 days, so they have improved slightly. Then you've got the contact tracing, which has been, I think, reduced quite a bit. Now they're very strict in terms of who is actually a positive contact, who is a casual contact, and things like that. Then you've got the isolation, and I think honestly we've run out of place to isolate these patients. Like, I know a lot of our quarantine centers are packed. Hospitals, especially in Klang Valley, are absolutely full over the brim. And then you have the support system. So the support system obviously has failed in the fact that we have so many suicides in the past 6 months. So there's nobody supporting these quarantine patients or possible positive patients or the positive patients. So basically the whole system is not running well.
You say that, not me. What I would like to add on is this.
I'm trying, because it's a public platform, I'm trying to be as politically correct as possible. So what do you think is the ideal way that Malaysians or Malaysia, what can Malaysia do? What is the ideal way that we can get out of this? What should be done? What is in an ideal situation? It's like, imagine you're in a Hollywood movie and this is what you would do if you were the public health consultant.
I think the first thing is whoever is in charge needs to go on top of a mountain, meditate, get clarity on the situation, and accept the facts. So the issue is this, right? And I would say it's not only other people's problem, it's also a problem with medical people. As medical doctors, we have had so much of success in the past 100 years. We have prolonged life. We have got rid of infectious diseases. We were coming up with measures how to increase life to about 120 years, for example, longevity. I think we just have to accept that sometimes a disease comes your way and you just have to live with the disease. Now, to adapt to the disease, you have measures such as vaccination that's going on, right? I think vaccination is very important, but we may not, I don't think so. We are able as humans to prevent the spread of the disease. It is time that we accept, and this is where we go from containment to mitigation. Another Jekyll and Hyde situation with result in relation to not our government, but some government's measures, right? The policies that we have are Jekyll and Hyde. It's like containment, mitigation. We're going to mitigate, but then we do not want the political baggage that comes with mitigation, so we go to containment again. We say, no, we're getting rid of the disease. The disease will end. Then someone along the way comes and says, doesn't make sense. Okay, we mitigate then. And then no, containment. So the point I think is that we have to mitigate now. We have to learn how to live with the disease. We have to get rid of our fear. The first thing is fear, right? What I find is in social networks, in a lot of networks, right, whether it be social media or your own social friends or WhatsApp or whatever it is, fear propagates very fast. Emotions propagate very fast. At the moment, there's not much hope. So fear propagates. And we overreact to fear. And I think the politicians overreact to fear massively. So they react to their people. So when the Rakyat have a lot of fear, have a lot of concerns, because of poor leadership strength or poor leadership, we have this thing where a lot of policies get influenced by the Rakyat, and actually the Rakyat in themselves get influenced by media. Okay. So there's a very bad positive. Cycle. It's a vicious, positive vicious cycle that's going on. Number one, and we all live in echo chambers, right? I'm sure you have a lot of followers, but your followers listen to Rakhee. So that's an echo chamber by itself. Same way, other people have other echo chambers. And the problem with media nowadays is the algorithm of the social media sites creates echo chamber. To give you an example, let's say I don't like vaccination, right? I go to a website or I go through my Facebook or Instagram and I see something which is anti-vaccination. Just by clicking like, the algorithm at the back end reinforces that thought. And whatever you see over and over and over, that influences you. So echo chambers are another thing. The disruption of communication, whereby nowadays we are all predicated by some algorithm, deep algorithm, that is in itself not biased, but it reinforces what we think. And that to me is another issue that we have not handled well.
Okay, so like compared to our neighboring country, I'm just going to throw this out there. Singapore has lately suddenly said that they're not going to do the daily numbers. They're going to do this. They're just going to concentrate on vaccination. They're just going to treat it like a flu. What is your thought on that?
Okay, so I've got
I
two
mean, we
thoughts
love
on that.
Singaporeans. I have Singaporean relatives and friends,
So,
but just to
two examples, okay? 2 points. First point is anybody who gives me an example of Singapore, Taiwan, New Zealand, Australia, or South Korea, I usually tell them that this are basically either island states, island countries with very strong border control, and we cannot compare ourselves with them. That's the first point. Second point, though, this move of theirs to be more mitigative, I think it's a very good idea. It's the whole point. We have to live with COVID. How are you going to sustainably live with COVID? So my point, the other point that I bring up, right, and I'm trying to bring this up in the media, but it's not getting picked up. It usually doesn't get picked up because of its message. The point is, we have to live with COVID in a sustainable manner. Yes. What we have proven in the past 17 months, since March last year when we had the first MCO, is that we maladapt very badly to the virus. We are not adapting to the virus. We want the virus to adapt to us. Yeah. If we have the power of God, maybe, but life is life.
Yeah, correct. Wow. So with that, what are your like maybe comments or advice to especially those who are in Selangor, those who are in the EMCO areas? What is your advice to us? Besides staying at home, which we already are doing. But what else?
Trust me, Rakhee, even me, I get fed up staying at home. The only people I see are my children and my wife, and life is life. But the point is this, right? The point is the EMCO, I think, is a good move, not because of movement restriction, but because they're testing a lot more. So whenever they call onto an EMCO of an area, they're supposed to be testing the whole population, right? The whole population sits down, you test the whole population, you get a better understanding of the disease at that areas. Typically, before calling an EMCO, they look at test positivity. That means among the people who have been tested from this area, how many % are positive? Typically, only when a large number of people are positive in an area, then they do an EMCO. An EMCO costs a lot, right? It has psychological costs. It's making all our minds go crazy. It's got a social cost. It's disconnecting us from movement restriction. Has been here for 17 months. We've been not able to move and talk to people for 17 months. Other than that, it has a financial and economic cost. Now, the problem is, I don't think so our country is rich enough to actually have an EMCO, a nationwide EMCO. We have spent a lot of money in the past 17 months. And what do you get of it? Nada. Nothing. Yeah. Right. You see the cases going up. The problem is, in my viewpoint, is we have spent money at times when we did not have to spend. We created fatigue when we did not have to. And as a result, now when we really need people to comply to SOP, when we really need the money, we may not have the money. It's because we have misspent it over the past 17 months.
Yeah. Wow. So
a lot of frustration.
Yes, I can see a lot of frustration, and I'm so frustrated as well. But you see, none of this comes out in the media. We just get told, okay, the healthcare system is overwhelmed. We just get told the cases are going up. Yeah, but what is happening to mitigate this? I mean, there's so many ways we can actually look to different countries. We may not be able to compare to the island countries, but maybe we can look at them to some sort of see how we can...
I would not look at them. What I would do is I would look at countries like Sweden, Norway, Scandinavian countries. See, Scandinavian countries have very good public health principles in play, very forward-thinking countries. If you look at them, they never introduced quarantine, community quarantine, or also known as lockdowns. They never introduced masks. To me, face mask in public was useless. until community transmission is high. Like now, community transmission is high. We need to use face mask in public. But my point is, we have to calibrate these measures. See, one of the problems is we've been hitting a message for past 17 months. We have been saying, wear face masks, wash your hands, keep physical distance, wear face masks, wash your hands, keep physical distance for 17 months. Even the bird around here that's moving around will get fed up and fly away. The problem is there were times when we didn't need these measures, but we thought that it would be good to have a standardized messaging. The problem with standardized messaging is it wears off over time. So like now, if you ask me now, if you're living in Selangor in KL, please stay at home. Now is the point when you should stay at home. I'm not so sure about 1 year ago or 17 months ago, but at the moment, test positivities are high, community transmission is high. It would be a good time to stay at home right now. And hope that things get better.
I'm just going to add on to that. If you are unwell, please go and get yourself tested and checked up on, because the rate of people dying at home, meaning brought in dead, what we call BIDs, if you see in the media, BIDs, which is brought in dead, is 27% in Selangor. So almost a quarter of us are dying at home for whatever reasons. So if you're unwell, please get yourself checked. In that case, don't stay at home. Go to the nearest CAC or COVID Assessment Center and get yourself tested. For the rest of those who are healthy and fine, just stay at home and limit your exposure to everybody else and get yourself vaccinated. And register yourself on MySejahtera and just keep checking your app and the website to hopefully you get your appointment date soon. So, I mean, thank you so much, Prof. Sanjay. I mean, this was a very enlightening, encouraging, as well as in a little bit way discouraging as well, because now that I know the facts and, at least everybody else out there who might be watching these knows what is going on. And one more thing to add on to that, like what Prof. Sanjay said was, some of these measures should not have been placed in the beginning, and so we've sort of gone fatigued about it, but it's just because science changes. Someone asked me, oh, but in January, you can't give the vaccine to children. Now you can. So I'm like, yes, data changes, science changes. We are constantly doing research. Trials are continuously ongoing. So in that sense, you can't compare something that has happened in April 2020 to what is happening to April 2021, So 1 year has gone by. Every day new data comes up, every day science changes. So in that sense, as we get more and more information, we should be able to follow and mitigate ourselves in some way to, adapt to the new norm, so-called, and the viruses. So thank you so much, Dr. Sanjay. Is there anything else? Sorry, Prof. Is there anything else you'd like to, before we wrap this up, you'd like to say?
Yeah, sure. So as I just reinforce what you said. So last year when COVID first came out, one of the fears was this was a life-ending, a population-ending pandemic, that we were all going to die from a zombie virus.
Zombie outbreak.
But zombie outbreak, right? Zombie war. But what happened is we've learned a lot. It's not going to end our population. It's just that we have to live with it. And yes. I put forward this thought again that normalcy to me means normal. Right. The way the future I see is a future where we vaccinate the whole population once, right? And then we're done with it. We throw away the face mask, we throw away the physical distancing, we throw away everything. Think Europe. People will get infected. But the point is, after vaccination, if you get infected, the severity reduces even further, which means we're looking at a long-term view where COVID becomes new flu, for example. Yeah. So the point about living with it is we have to get rid of our fear. We have to live with this virus. Let's live with this virus in a sustainable manner that we all can accept. Thank you, Rakhee, for the opportunity.
Thank you so much, Prof. This is excellent, and I might take you up on another offer to do another live session soon once data and science changes. But thank you so much once again. Take care, and I'll see you around. Bye-bye.
Take care, Rakhee. Bye. Take care all.